Let me talk a little bit about the issues as the McCain campaign has seen them. We do agree in describing what the problems are that this country faces. Unsustainable healthcare spending, quality problems and patient safety issues, and way too many people without insurance coverage. And the question is, how is it that we get our arms wrapped around these issues? Not surprisingly, we have some differences in terms of where we think we need to start and how we need to roll out changes. There are some tough issues that any healthcare reform plan needs to resolve. There are no easy wins without downsides. Each of the solutions has positives and negatives, and one of the issues that the country and ultimately the Congress will have to decide is, on balance, which of these strategies works best. Let me give you some examples of what I mean. If you tie insurance to employers in a mobile labor economy, and there is nothing more mobile than the American labor economy, you are insuring disruption, because when people change jobs, they will change the insurance they have, and usually, therefore, the network of physicians that they have and nurses that they have available to them. It also tends to hide the cost of insurance. The single most unknown piece of information is how much does your employer contribute to your insurance. People don't know, and it's frequently not what they would have chosen, even in terms of just the benefits. Second problem is some people are predictably high spenders. How you need to deal with that, or how you choose to deal with that, can differ. You need to compensate at some point for people who are predictably high spenders. Whether you force insurance companies to pretend they can't tell that some people are predictably high spenders and try to fix so that they don't have windfall gains and losses is one strategy. Or you can try to compensate individuals or make other means of adjusting for these predictably high spenders. The problem is there. The strategies are varied as to how to try to respond. If insurance is not compulsory, you run the risk of free riders. If you have more support and more access, you will have some people who will be free riders. How much you choose to be bothered by that is an issue. If insurance is required, in Senator Obama's case, the only mandate that exists is for children, it's not clear what it is they're mandated to have or how it would be enforced. But once you have a mandate, you have to define what it is that people have to have. That raises a whole series of other issues, and be prepared to enforce it somehow. To me, the most critical of the issues we have to solve is finding ways to moderate spending. We are absolutely in a path of unsustainable spending increases, and because health insurance spending increases is the single biggest predictor of increased numbers of people without insurance coverage, it exacerbates the problems that we've been facing in this country. What Senator McCain has done is to focus on making insurance more affordable by trying to look at some of the underlying drivers of healthcare spending and recognizing that when people change jobs frequently, having insurance portable for many will become an important part of going forward. So what the McCain proposal has focused on is that the current tax exclusion, where you don't have to count what your employer pays as part of your taxable income, is extremely inefficient and extremely unfair. And the reason it's inefficient is because it distorts the choice between wages and insurance coverage, because you get to use pre-tax dollars for one and not for the other. And it's unfair because the higher your income, the more value it is to us. It's therefore why the notion of changing the tax code and in its place having a refundable tax credit is so important. It puts the money to the individual, and it makes it into a much fairer way in terms of how it is being distributed. $5,000 for couples, $2,500 for individuals. These are not small amounts of money. Most middle-class people get actually far less from the current subsidy now that we have in terms of how health insurance is being subsidized by employers. Why is this important? Well, it will help make insurance clearer what it is you're buying, what it is it costs, and if you change jobs, whether or not you want to keep your insurance or whether or not you want to have the insurance that your employer offers elsewhere. And as I've indicated, it makes it more equitable and portable if you want it. He has also proposed having access to an open insurance market where people can buy insurance in other states. Now, why has this been an issue? There are a lot of places where the insurance market is effectively dominated by a blues plan, 70%, 80% of the market. You don't get a lot of competition or pressure. You frequently don't get variation in terms of what benefits are offered, sometimes because of what the state has required and sometimes because of what the plans make available. This is to put pressure on companies, on plans, to offer the kind of insurance benefits that people want and to reduce their overhead expenditures because people can go elsewhere in order to reduce that. Of course, if states want to continue trying to make pooling arrangements available, McCain's plan encourages, both in terms of Medicaid and in terms of this, state flexibility. So there's no reason that states can't continue to experiment in ways with making insurance more available to the population. But it is really to allow people to access markets that have been closed to them. One of the issues that has been raised is, what do you do about predictably high spenders, high-cost individuals? Well, there are some provisions that are already in place and that would continue in terms of state law. That is, we have a HIPAA law and people who have employer-sponsored insurance. And our presumption is that right now, 98, 99% of large employers provide insurance, and our presumption going forward is that almost all large employers will continue to provide insurance. For people who have insurance coverage and continue in a group coverage, which is basically 2 and more, the HIPAA rules provide a lot of protection with regard to pre-existing conditions. It is less true for people who start out in the individual coverage or who never had any coverage and who have some pre-existing conditions. And making sure there's a way to help people who are predictably high spenders and who won't have access to group insurance is an important issue. And what the senator has proposed is having subsidized state high-risk pools. Now, high-risk pools at the state level have gotten a bad rap, and usually for one good reason. Nobody's been willing to put the money up. And Senator McCain has indicated this requires new money. He is going to be willing to put new money on the line. He would like to encourage flexibility in terms of how states would do this. He said he will get the governors together to talk about various strategies that they have found work. It is not a problem that can be ignored, and it isn't ignored in the plan. There are various other strategies that have been proposed in order to try to moderate spending. David's talked about some of them. Spending more money in terms of federal research for chronic disease and more of a prevention focus. Promoting information technology. There's been an interesting way that was included in the bill passed in July that had the first couple of years with a small incentive for e-prescribing, followed by a penalty in years 4 and 5. I think this is an interesting model. We'll see how it works in terms of how you might go forward without having a large new cost involved. Emphasis on price and quality transparency, and an understanding of the need to reform payment for the entitlements, Medicare and Medicaid, not just not paying for the never events, but certainly that, but also rewarding the kind of behavior and response that we want from physicians and institutions.